Hi, I'm Dr. Wanda Shurney, and I am excited to talk to you about a medication that can improve the lives of individuals living with sickle cell disease. Mark, I hear you're thinking about taking hydroxyurea. I bet you have a lot of questions.
I sure do, Dr. Shurney, and to tell you the truth, I'm a little nervous about it. First of all, what is hydroxyurea?
Hydroxyurea is a medication that can decrease many of the complications of sickle cell disease. It is taken by mouth once a day and comes in a liquid or capsule form. It is also known by the brand names Hydrea, Hydroxyurea, and Cyclose.
Can you tell me how it works?
Children and adults with sickle cell disease continue to make small amounts of fetal hemoglobin. People with higher levels of fetal hemoglobin have fewer complications and live longer. One of the ways hydroxyurea works is by increasing the amount of fetal hemoglobin and therefore decreasing the amount of sickle hemoglobin. Higher fetal hemoglobin levels improve the shape and function of the red blood cells. Many of the complications in sickle cell disease are caused by blocked blood vessels. Hydroxyurea helps the red blood cells to travel more easily through the body. Hydroxyurea boosts fetal hemoglobin, but has other benefits too, so the fetal hemoglobin level is not the only improvement doctors look for.
How does hydroxyurea help people with sickle cell disease?
Studies have shown that hydroxyurea decreases the frequency of painful crises, decreases acute chest syndrome, decreases the need for blood transfusions, and decreases hospitalizations. Follow-up studies have shown that patients who take hydroxyurea live longer.
Are there any other benefits?
Many patients have experienced increased energy levels, increased appetite, weight gain, decreased yellow jaundice, improved growth, and all of that leads to a better quality of life. I want you to see an actual picture of the red blood cells from a patient before taking hydroxyurea and after taking hydroxyurea. Notice in the after picture, there are fewer sickle cells and more normal cells.
Dr. Shurney, if I start taking this medication, am I going to see the results right away?
No, Mark. Usually it takes several months to see the effects. The medication must be taken every day for it to work well. If you have a pain crisis while taking hydroxyurea, it doesn't mean that it's not working.
So hydroxyurea is a pain medication, right?
No. Although hydroxyurea has been proven to decrease the number of pain crises you may have, taking it on a day when you're having pain will not provide relief for that particular episode.
How long will I have to take this medication?
If hydroxyurea works well for you, your doctor may recommend taking it for the rest of your life, unless other treatments become available. But remember, Mark, you can decide to stop taking it at any time. It's your decision.
Is hydroxyurea a cure for sickle cell disease?
No. Although it is not a cure, it can greatly reduce some of the complications and therefore improve the quality of your life.
Can you guarantee that hydroxyurea will work for me?
You know there are no guarantees in life. Not all people experience all of the benefits, and some, although rare, experience no benefits at all. Doctors feel that at least some of these treatment failures occur because the medication is not being taken as directed. Hydroxyurea must be taken every day at the right dose in order to work well.
So hydroxyurea is safe, right, Dr. Shurney?
Hydroxyurea has been used for over 20 years to treat sickle cell disease, and even longer for other conditions. Many clinical trials have proven that it is safe and effective. Many patients experience very few or no side effects. Hydroxyurea will slightly decrease your white blood cell count. Your doctor will need to test your blood periodically to monitor your white blood cell count. White blood cells are important for fighting infection. If they are too low, your doctor will lower your dose or hold the medication until your counts improve. Other side effects are less common and may include nausea, which is often improved by taking it with food, thickening or discoloration of your nails, darkening of skin creases like over your knuckles, hair loss or thinning of your hair, which is uncommon. Talk to your doctor if you're having problems taking hydroxyurea.
Dr. Shurney, here's one of my biggest concerns. Does it cause cancer?
After 20 years of use for sickle cell disease, the cancer rate has not increased in patients taking hydroxyurea.
Is it safe during pregnancy?
Currently, there's not a lot of evidence about how hydroxyurea affects a pregnancy. If you are of childbearing age and are taking hydroxyurea, you should use an acceptable form of birth control. If a woman becomes pregnant, she should talk to her doctor about whether she should stop taking hydroxyurea. So, Mark, I know I've given you a lot to think about. Starting hydroxyurea requires a commitment. You have to take it every day, and you have to make frequent trips to your doctor to have your counts monitored. Hopefully, that will be balanced by less pain, more energy, and less hospitalizations. Some people find it helpful to speak with someone who's already on hydroxyurea. I hope this information has been helpful to you. Will you let me know what you decide?
I sure will, Dr. Shurney, and thanks for all that information.
Talk with your doctor to learn if you or your child could benefit from hydroxyurea treatment. They will be able to answer any questions you may still have. Okay, so now that you have watched my little animated video about hydroxyurea, we need to do a little update because we know a lot more about the effects of hydroxyurea on fertility. And so I just really want to hear your thoughts about that.
Thank you so much for that really important question that I've spent a lot of time thinking about. The first thing I want to say is that we're actually still not totally clear about the effects of hydroxyurea on fertility. But what we do know is that people who have an indication to take hydroxyurea, which is every baby born with SS disease and S-beta null thalassemia, all of those children are at risk for lower egg supply as they get older.
Just by having sickle cell?
Just by having sickle cell.
Not even with the hydroxyurea, okay.
But it's possible, it remains possible, there's not agreement in the literature about this, that hydroxyurea could make the egg supply decrease faster. But we don't know that for sure yet. But what we do know is that just by having sickle cell, if you have an indication to take hydroxyurea, that you're at risk for having lower egg supply. And so to me, what that means is that we have to talk about these issues alongside talking about hydroxyurea and alongside talking about treating sickle cell disease.
And so what about sperm counts?
So sperm counts are low in people with sickle cell disease at baseline. Sickle cell disease damages the whole body.
Yes.
Testicles are part
so
of
it makes sense.
people's bodies. So it makes sense, right, exactly. It looks like hydroxyurea does reduce sperm counts. And it also looks like if you stop the hydroxyurea, the sperm come back. Now, the level to which they come back is not totally established, but clinical experience suggests that that's what happens.
Okay, so still unanswered questions, right?
A lot of
and so questions. The way I try to do things is like weighing the risks against the benefits.
Yeah.
And when you talk about hydroxyurea, I mean, what do you say to the actual person living with sickle cell disease about the impact that sickle cell disease can have on their life versus the impact of hydroxyurea?
Well, I just want to say I think your patients are so lucky to have you. That's the first thing I wanted to say.
All right, good.
But to speak to that point, I think the first thing to say is that for a long time we took care of people who had untreated sickle cell disease because until the mid-90s we didn't have a treatment for sickle cell disease. And so we know what untreated sickle cell disease
is problematic. And treated sickle cell disease is much better, right?
It's much better.
All right.
So I think, the first place we start is we did that. We did untreated sickle cell, and it was literally a painful story.
Right. Okay.
Right, and a devastating story. So I think the first thing is we really have to talk about how transformative treating sickle cell is. It lets children go to school.
Right.
It lets parents go to work.
Right.
And I think it builds a lot more sustainable expectations. The uncertainty of this disease is really harmful, and so it builds a little more stability, a little more certainty into everybody's lives. So we're balancing profound
Right.
benefits.
Right.
It's protecting your body,
Yes.
it's protecting your
Yes.
social life, it's
Yes.
protecting your
Yes.
work life,
Yes.
it's protecting your
Yes.
participation
Yeah.
in school against
Some
theoretical
things.
risks.
Yes.
And not only that, but there are risks that we should be able to address with existing medical care.
Yep.
And so to me, and then the last piece is that we want to get you, nobody's reproducing, we hope, right, until they are ready
Right.
to be parents.
Yes.
And once they're ready, we want their bodies to be in the best shape possible to
Right.
be the parents they want to be.
Mm.
And to get to that place where you're ready to be a parent, where you're ready to have a family, we want your body, your brain, every part of you in the best
be
shape
ready.
possible. I mean, being a parent is a full contact sport.
Right. And that's the oldest and most tried and true medication that we have right now, right?
Oldest
we know
and best.
more about it than we know about any other medication for sickle cell disease.
Oldest and best.
Yes, there we
I mean,
go.
I think.
Okay. All right.
Yep.
That's very, very helpful. So, thank you.
Thanks for
Appreciate
including me
you.
in this conversation.
Absolutely. Yep. Essential.
The information contained in this whiteboard is meant to be helpful and educational, but it is not a substitute for medical advice. Symptoms, risks, and benefits may vary for each individual.